Hi everybody, welcome to my YouTube channel Dr. Sreenivas Medical Concepts and my FB page Dr. Sreenivas Concepts. This is Dr. Sreenivas, neurologist from Rajahmundry, Andhra Pradesh, India. I am also the medical author of the book Focused Neurology. My email is sreeklpm@gmail.com. Today we are going to talk about horizontal gaze abnormalities, cranial nerves part 38 and ocular motor nerves part 24. So today we are going to talk about horizontal gaze abnormalities. To understand what happens if there is a lesion in the front light fields area number 8, if there is an excessive irritative effect due to seizures in front light fields area number 8, or if the lesion is in the pons, how the eyes are placed, whether it is on the same side or on the opposite side. To understand all these phenomenon, we need to first understand the supranuclear pathway subserving horizontal gaze, that is the saccadic pathway. So the saccadic pathway, as you can see in the diagram, this is a type of horizontal movement. Basically we have horizontal movement, we have vertical movement. Horizontal movement, there are basically two types. The saccadic movement, the fast movement. I look at the camera, someone knocks at the door, I immediately see this fast component is known as saccadic pathway. Suppose I see a nice shuttlecock match being played between two international stars, I just keep following the shuttlecock. This is known as pursuit movement. Whatever may be, whether it is a pursuit movement or saccadic movement, they are all horizontal eye movements. The center is in the pons, known as paramedian pontine reticular formation. Then we have vertical eye movements, that is looking up and down. So we have up gaze looking upwards, we have down gaze looking downwards. The center for all the vertical eye movements is in the midbrain. So now let's see this saccadic pathway, which helps us to understand why eyes look to one side and hemiplegia on the opposite side in a frontal lobe lesion, why eyes look towards the side of hemiplegia in a pontine lesion. To understand this, we need to know the saccadic pathway and understand this diagram. So imagine I need to push my eyes to the left side. So how does this happen? This happens because a tract originates, that is the saccadic pathway originates from the frontal eye fields area number 8. It slowly descends and crosses at the level of the midbrain and pons towards the opposite side and goes to the PPRF on the opposite side, as you can see in the diagram. So PPRF, the function of the PPRF is to, through the sixth nerve nucleus, connect lateral rectus on the same side and medial rectus on the opposite side through MLF, medial longitudinal fasciculus. So when my frontal eye fields area number 8 is stimulated, the PPRF on the opposite side gets stimulated and it pulls the eyes towards its side. So you can see in this diagram, the frontal eye fields area number 8, the pathway descends at the level of the midbrain and pons, it crosses over to the opposite side, goes to the PPRF. From there it comes to the sixth nerve nucleus, it goes to the lateral rectus on the same side and through MLF, the medial rectus on the opposite side. So the frontal eye fields area number 8 is stimulated on one side, the eyes move towards the opposite side. Having understood this, now we can place the lesion. So what happens? So the BPRF draws the eyes ipsilaterally in contrast to the FEFs, which force the eyes contralaterally. So when you are faced with a patient whose eyes rest eccentrically to one side, there are three possibilities. If the eyes lie eccentrically to one side, there are three possibilities. One, there could be a frontal eye fields area number 8 seizure activity. So it's an irritative lesion. So it stimulates the PPRF and it allows the eyes to drift to the opposite side. So if there's a frontal lobe seizure activity, eyes move towards the opposite side. On the contrary, if there's a destructive lesion like an infarct in the frontal eye fields area number 8, it cannot push the eyes towards the opposite side. So eyes will move towards the same side. So now the tract has crossed and gone to the PPRF. So if there's a destructive lesion in the PPRF, what happens? Paramedian pontine reticular formation pulls the eyes towards its side. So the pons gets destroyed, that the PPRF gets destroyed, eyes cannot be pulled towards its side, so eyes will move towards the opposite side. So by just looking at the patient whose eyes rest eccentrically to one side, we can even place the lesion. The possibilities are frontal lobe seizure activity, pushing the eyes to the opposite side, frontal lobe destructive activity where the eyes move to the same side, or a pontine lesion where eyes move to the opposite side. Along with the eccentric gaze, if we see the hemiplegia, we will still be able to place the lesion better. So if there is a frontal lobe seizure activity, eyes move to the opposite side, corticospinal tract also may get affected, so hemiplegia also will be on the opposite side. If it is a frontal lobe destructive activity like an infarct, it cannot push the eyes towards the opposite side. Eyes will move towards the same side, but corticospinal tract descends and crosses at the level of the medulla oblongata and goes to the opposite side. So eyes looking to one side and hemiplegia on the opposite side is a frontal lobe destructive activity like frontal lobe infarct in the frontal eye fields area number 8. Pons, PPR pulls the eyes towards its side. So if there's a lesion in the pons like pontine infarct, it cannot pull the eyes towards its side, so eyes will go to the opposite side. The corticospinal tract descends, traverses to the pons and crosses at the level of the medulla oblongata and goes to the opposite side. So if it's a pontine lesion, eyes will move towards the opposite side. Hemiplegia is also on the opposite side. So eyes looking towards the side of hemiplegia is a pontine lesion. Eyes looking to one side and hemiplegia on the opposite side is a frontal lobe lesion. So by just knowing the saccadic pathway at the bedside, we can even diagnose the patient's lesion clinically. That is the joy of clinical neurology. So these are the important concepts of the horizontal gaze disorders. The other important concepts of neurology, I put it in a question and answer format in a book, Focused Neurology, written by me, Dr. Sreenivas. It is available online from all leading booksellers, including Amazon. So if you're interested, it could be bought online. If you have liked this video, Horizontal Gaze Palsy, please share the link to your friends. Please like the video and please subscribe my YouTube channel, Dr. Sreenivas Medical Concepts, and my FB page, Dr. Sreenivas Concepts. Thank you. Bye.